Okay, well, I think we're going to start. I'll begin with a few introductory remarks, so if there's any latecomers, they can join us. So thank you ever so much for your time this afternoon to come to our webinar, looking at our first report from the Scottish Social Security, the Scottish Commission on Social Security. We'll be here until 3 o'clock, and we do aim to end by 3. I know some people have to get away. We're having British Sign Language interpreter is being provided by Neve, which you should be able to see in the top right-hand corner of the screen. There is also live captions available for people who would prefer to use that. Briefly, if you want to get live captions, if you click on the More button in the kind of top right of Teams, and then go to Language and Speech, and then go to Show Live Captions, that should be able to show you, you should get live captions up. They're automatically generated, but they can be useful. The webinar is being recorded and it will be made available afterwards to attendees and others who weren't able to attend. And as I said, cameras and microphones have been turned off. If you do have any technical issues during the webinar, please email the address that the invitation came from, info@socialsecuritycommission.scot, and someone will be able to give you a hand. Also, we will try and provide a visual description of any slides. Mostly the points on the slides will be covered in the notes, but if there's anything on the slides that needs covering, then we will give a wee visual description of that as well. Excellent. Well, welcome all. My name's Ed Pybus and I'm the chair of the Scottish Commission on Social Security, which we'll refer to as SCoSS throughout today's session. We'll try and keep acronyms to a minimum, but that's one we do use quite a lot. My background is in welfare rights. I've previously worked for the Citizens Advice Bureau as a welfare rights worker and the Child Poverty Action Group, and I was very pleased and honoured to take on the role of chairing of SCoSS in August last year. So I've been 10 months in the role. It still feels very new, but a great experience. So I'm just going to give you a brief overview on what we're going to cover today. A brief introduction to SCoSS and what we do and why we do it for those who don't know, and a bit of an overview of our involvement in the Scottish Social Security Charter, and then we'll move on to the main part of the webinar, which is looking at the research that we've done, the key findings we found and recommendations that we've presented to Social Security Scotland relating to people with communication needs and the Scottish social security system, looking specifically as whether the expectations in the Charter are being fulfilled. So yeah, first of all, just a brief introduction to SCoSS for those who don't know. We were established as part of the Social Security Scotland Act in 2018. And so our remit, our roles, our responsibilities, our functions are set out in primary legislation. So it's very clear where our responsibilities lie and what's outside our responsibilities. There's 5 members of the SCoSS board, and we're supported by, at the moment, 5 members of staff. We're separate from the Scottish Government, but the Scottish Government do provide our resource, which allows us to do our work, and we carry out work independently, both the Scottish ministers and the Scottish Parliament, although both the Scottish Parliament and the Committee of the Scottish Parliament can ask us to carry out work if they so wish. I think the key thing that we do is we scrutinise draft regulations for Scottish social security benefits, and that's a key part of our work, and that's what we've been spending a lot of the past 10 months doing. So any new benefits or any changes to the benefits and regulations come to us, and we provide a report scrutinising them, which goes to the Social Justice and Social Security Committee at the Scottish Government, at the Scottish Parliament, as well, before the regulations become law. And when we're fulfilling those functions, we're obliged to take into account the social security principles, which are also embedded in the Act, as well as relevant international human rights instruments as well. So, and one of the key principles is that social security is a human right, so very much embedded in our scrutiny process as a sort of human rights approach. We also, which is why we're here today, report on the delivery of the commitments set out in the Social Security Charter. I'll come on to that in a moment, but first I just want to introduce my my colleagues that are here today. So a slide shows photos of myself and my two colleagues, Dr. Mark Simpson and Dr. Marilyn Howard, who are the other members of the Charter Subcommittee who have been involved in this work. So Marilyn, I'd ask you if you want to just introduce yourself first.
Hello, I'm a member of the Scottish Commission on Social Security, and I've had experience around disability benefits, and I'm currently a Policy Advisory Committee member of the UK Women's Budget Group.
And Mark.
Yeah, hello everyone, and thanks for joining us today. I'm Mark Simpson. I'm a member of the SCoSS board, and my day job, I'm a senior lecturer in law at Ulster University, in which capacity I've been researching social security, particularly but not exclusively, in the devolved context since about 2012.
Thanks both. And the whole SCoSS board, as I say, there's 5 members of the board, and we decided to set up a subcommittee to look after this charter work. So the report has been the research topics and the way the report's developed has been approved by the whole board, but we took on the role of taking this forward. We welcome questions throughout this event, so please do ask questions. The chat's been muted, I think, but you can make any comments or questions through Slido. So there is a link sent out in the invitation, but it's also, I think, available in the chat. I won't try and open another window because my computer might not like it, but there's a link in the chat you can click on. There's also a QR code, so many thanks for the team that created that. And so if you've got your phone, you can just focus on the QR code and that will take us to the Slido. So please do ask questions as we go along. We'll do the presentation first and then we'll come to any questions at the end, but please do feel free to pop questions in as we go along, either about SCoSS and the charter work in general or about the report, and hopefully we'll manage to cover them all. If there's questions left over at the end, we can always get back to people afterwards if that's useful. So yeah, as I mentioned, one of our roles is to report on how well the delivery of the commitments set out in the Social Security Charter are met. The Social Security Charter is, again, it's required in the Act, and it's been co-designed by the Scottish Government, Social Security Scotland, and people with lived experience of the benefit system. SCoSS also feed into the development of the Charter, and it sets out in quite a lot of detail what people are entitled to expect from Scotland's social security. And hopefully in very practical, real ways. So some of the commitments and expectations that we have looked at in this report are things like Social Security Scotland will ensure staff understand the needs of different people and the barriers they face, or they will adapt processes and ways of communication as much as reasonable to meet people's needs and preferences. So these are the kind of things that are set out in the Charter, and that's what we're measuring Social Security Scotland against. And we have a duty to report to the Scottish Government and to the Scottish Parliament on whether we feel those expectations in the Charter are being fulfilled. So that's but part of our remit that we're looking at today, and this particular report came out of research that Social Security Scotland did, a client survey, and they highlighted a pattern of slightly lower satisfaction ratings among certain demographic groups, which included people with communication needs. So this flagged up a slight concern for the SCoSS board, and that's why we decided to undertake this piece of work as our first piece of work looking at the Charter. So there's an example up there. The overall experience rating for people with communication needs was 84%, which is lower than compared to those without communication needs, which was 90%. So 84%, it was still, people generally were having a good experience, but it is markedly lower than compared to people without communication needs, and the same was across a number of different metrics as well. They were less likely to agree that they had choice in how to communicate, or they were less likely to rate their experience as good or very good, or they were more likely to say they faced barriers getting the help they needed. So there was a bit of a pattern that came out in the stats, which is why we decided to do this piece of work. And it was, so a focus of this is based on people with communication needs who will primarily people with a disability, but not exclusively. And what we did, research is the method we went through is in quite a lot of detail in the report, and I won't go to it in too much depth, but if you've got any questions on this, do ask. But what we did is we worked with a number of third sector organisations to hold focus groups with people with communication needs. We also spoke to welfare rights workers and support workers who also have a good idea of the system. We had some structured interviews with people from the third sector with expertise in communication needs, and we've held a couple of meetings with Social Security Scotland as well as the process has gone on to discuss our findings and understand how the processes should be working. So all this has fed into our report. So that's very much a bit of an introduction. We'll move on now to what we found from this research and what some of the recommendations are. So firstly, I'm going to pass on to Marilyn to speak through some of the areas of key findings and recommendations, and then pass on to Mark to discuss some of the further ones, and then we'll come back for some questions at the end. So Marilyn.
Great, thank you, Ed. And so we, as Ed has said, we use charter expectations to analyse what people have told us, and we write about it in the report under the 3 themes that are flagged up on the slide there. So it's the first one is interactions with Social Security Scotland staff. The second one is barriers to getting help, and the third one is the issues with the application process. So in a moment, I'm going to mention some of the main things we found out about interactions with Social Security staff, and then Mark will talk about barriers and the application process. With the main findings, I think the first thing to say is that overall, people who participated in the research reported positive experiences with Social Security Scotland, and in particular for those with experience of claiming benefits from the Department for Work and Pensions, the service received from Social Security Scotland was certainly regarded as better. With one interviewer told us that overall engaging with Social Security Scotland is more positive, although added that actually room for improvement remains. So with interactions with Social Security Scotland staff specifically, as Ed has mentioned, some of the relevant charter expectations are about people being treated kindly, considerately, being listened to and treated as an individual, being treated equally and fairly. There's also expectations about being entitled to ask someone else to support you in your claim, and also about adapting processes and ways of communications to meet your needs, and ensuring that staff understand the needs of different people and the barriers they face. So with our key findings, which are noted on that slide, as I said, there are positives around call handlers and having clear approaches from Social Security Scotland. So, for example, one client said that the tone is positive and respectful when interacting with individuals. However, some people felt that staff didn't respond to their access or communication needs, which relates to the charter expectations of understanding needs and adapting processes and ways of communication. So, for example, as the slide states, that participants felt that staff didn't respond adequately to their individual needs. And for example, although there is guidance on communicating with people with hearing impairments, this didn't always appear to be followed. So, for example, one call handler asked a deaf client to make a noise on the phone to indicate that they gave consent, which both the client and their advisor felt was inappropriate and undignified. The other related issue was that some participants said they had to repeatedly explain their situation to different advisors and could also receive inconsistent information from those different advisors. So people felt that their needs should be flagged on record somewhere to guide how other staff members could interact with them in the future. So we understand that there is a communication needs indicator on Social Security Scotland's client record, but our research suggests that this isn't always being used in practice. The other point on this slide before we move on to the next one is that instead of having to ask for a particular way of being communicated with every time they have a contact with Social Security Scotland, participants felt that staff should also proactively identify communication and access needs rather than always waiting for clients to request an adjustment. So moving on to the next lot of findings on interactions with staff, which also reflect those charter expectations, is that in some instances staff were perceived as inflexible, not personalising the communication to individuals, which reflected the way that they wished to communicate and indicated a lack of understanding of specific impairments. So although the policies allow for flexibility, this didn't always seem to be happening in practice. And some people said they felt it was as though staff were following a script rather than adapting what they were saying to their individual needs. One interviewee told us that treating people exactly the same meant that this was arguably not a fair process if it's not been made clear in communications about what it means for them. So participants recommended that staff receive further impairment awareness training, particularly around sensory loss and also dual sensory loss. Finally, there are a couple of issues surrounding consent for someone to act on your behalf. So a client may have a welfare rights worker or support worker helping them make a claim, and Social Security Scotland has to ensure that the client has actually consented to this. But some participants in our research found that the consent process to allow Social Security Scotland to contact a support worker on behalf of the client was inaccessible, that responses to managing consent and getting a what's called a mandate to authorise someone to discuss your claim with Social Security Scotland didn't always work in the way that it should. And in some instances, welfare rights workers said they had to make a formal complaint in order to get the issue to resolve. They also told us that sometimes the process of getting consent was more difficult with Social Security Scotland than with the Department for Work and Pensions, which has got a slightly different approach. So in terms of the next slide, I think to summarise in relation to the charter expectations, we did hear about people being treated with patience, kindness and understanding, but also examples where people didn't always feel listened to or treated as an individual. And sometimes inflexible responses meant that people didn't feel they were treated equally or fairly, though this could be improved through training to extend staff understanding of the needs of different people and the barriers they face, and also to meet the charter expectation that someone's entitled to ask for support from somebody else when making a claim. So this work generated 3 key recommendations for us, which are on the slide there. So the first one is to ensure that people don't have to repeatedly tell Social Security Scotland about their individual communication needs, and that therefore having an accurate record of people's access requirements should be kept, maintained and used by staff. The second recommendation is that to ensure individuals receive appropriate communication support, Social Security Scotland should monitor and regularly review the types of support its client base may require. Third recommendation is to enable people with communication needs to express consent for a third party to act on their behalf, and Social Security Scotland should consider if there are ways to improve the way that it obtains consent. So I'll now hand over to Mark, who will talk about the barriers to getting help and issues with the application process.
Thank you, Marilyn. As Marilyn mentioned, our research participants talked about three broad areas of their experiences or their clients' experiences of dealing with Social Security Scotland, and barriers to getting help is the second of those. So we know from previous research by Social Security Scotland themselves, amongst others, that people can find the process of claiming benefits time-consuming and stressful. And many people need a bit of support with that process. In the 2022 to 23 client survey, which we've mentioned already, 28% of respondents with communication needs reported difficulty accessing help, compared to 13% of all respondents. And those with communication needs were also less likely to be satisfied with the information on Scottish benefits that was provided online. Now, the things that the Social Security Charter requires in this space include simple, adaptable communication processes, staff who understand and can respond to different people's needs, all this contributing to the delivery of a system that treats everyone fairly. Clearly, if you can't get the information you need in a format that's accessible or cannot communicate your circumstances effectively, there is a risk that you won't get a benefit you should be entitled to, or you will need someone else to do at least some of the work on your behalf. So as before, participants did have quite a few positive things to say about Social Security Scotland's service and their efforts to make that accessible. But we did have reports of inconsistency and some other frustrations alongside those. So one thing that was very much acknowledged as a positive was the availability of various channels of communication with Social Security Scotland. Unfortunately, not all participants were always able to exclusively use a channel that suited them. So we had multiple reports of people receiving letters in formats that the recipient wasn't able to read. This is to an extent unavoidable. The Social Security Act requires all applicants to receive a written notification of their determination, and there are good reasons for that. But it's also the case that letters can be generated in alternative formats, large print or audio, for example. And this didn't always happen in practice, or it could take time to receive those alternative formats. Telephone calls were something that was seen as particularly problematic by quite a number of participants. These were difficult for deaf service users for very obvious reasons, but could also be anxiety inducing for people with other needs. Again, alternatives are available, notably web chat. We had a lot of positive comments on the web chat, but we were also told of instances where someone had been using the web chat service, had discussed their situation, but then when they got to the end of that, was told they needed to follow up with a phone call to formalise whatever they'd just been discussing online. And I think the overall message was that some staff members seemed to be a bit more flexible and a bit more accommodating than others were. So we've got a couple of recommendations around the barriers to getting help. First is to ensure that no claimant is unable to access information due to their communication needs. We think Social Security Scotland ought to review its inclusive communication practices, make sure they're not creating any barriers to people interacting effectively with the Social Security system. And based on the conversations we've had with Social Security Scotland, we think as much as anything, this might just be a case of making sure that the flexibilities that are already supposed to exist in principle are actually being consistently applied in practice. Our other recommendation here is to understand and address any barriers to take up of benefits by people with communication needs. There should be further research undertaken by the Scottish Government and or Social Security Scotland. And as much as anything, this is a matter of being prepared. We think that if Social Security Scotland really understand the communication needs of their client base as a whole and how they can affect take up, that can help them be better prepared to respond to individual level communication needs as they arise. One example, there might be communication aids that could be offered that currently are not. One thing that participants in the research mentioned as being potentially helpful if it was available was a dictation tool on the Social Security Scotland website. It's just one example, though. So the final area of the findings, although again, you'll probably note a little bit of overlap with the previous two, certain recurring themes, is issues with the application process. So some of the key charter commitments here include giving support to people through the application process, referring people to advice, support, or advocacy external to Social Security Scotland where that's appropriate, and also to recognise that people's time is precious by handling their applications and making determinations as quickly as possible. Looking again to the client survey, 85% of respondents with communication needs had a positive view of the application process, and that compared to 93% of all respondents. So in our study, by and large, participants acknowledged the application process to be a fairly supportive one. People talked about the application forms being simpler, the questions being clearer and perhaps less intrusive than they might have experienced in the past. At the same time, they didn't necessarily see it as a fast process or one where support and advocacy were readily available or certainly promptly available. And in some cases, that the issue seemed to be simply a case of not being aware of things that were available. The advocacy service from Voiceability was a clear example of that. In other cases, we were talking about what you might call the day-to-day frustrations of bureaucracy, having to wait to speak to someone on the phone, needing to repeat something that you'd already told another staff member in a previous call, or having to be redirected to multiple call handlers in the course of a single call. Things that can frustrate anyone, I suppose, but that might have a worse effect on some people with communication needs. And then finally, in some cases, a support service seemed, from the point of view of the participants at least, to be genuinely difficult to access in a timely manner. And British Sign Language interpretation was an example of this that came up. If someone needed a BSL interpreter, they could get it, but they would have to wait, and that could delay their application. And some of these issues and some of the previously mentioned issues could, have an effect on the application process in the round. So if you have to wait for an interpreter, then that delays your application. Then if your determination letter is delivered in a format that you can't read, then that could delay your redetermination request or your appeal, and so on, and all the individual delays then accumulate. So again, a couple of recommendations flowing from these issues. First of all, to ensure that people with communication needs can access support from external organisations as quickly as possible. We think Social Security Scotland should work with the relevant stakeholders and partners to identify the causes of any delays and to address them. Ultimately, this has been a small study. We don't know how common the delays that that our participants mentioned are across the whole population of clients, or how long they typically are, but it seems to be something that's worthy of attention. And secondly, that we think there's a need to gather further evidence on people's understanding of what advocacy services are available and their awareness that they exist, and that might be something that could be included in future client surveys or other research by Social Security Scotland. So that it concludes the quick run through of the findings. I'm going to hand back to Ed at this point.
Thanks very much, Mark and Marilyn. There's a lot in the report, and we've hopefully briefly covered on the main points of it there. I'm just going to briefly speak about what happened to the report, and what happens next. But just a reminder that if you do want to ask any questions, we've already got questions coming up on the slide here, which I'll come to in a moment. But now's a chance to put in any further questions you have. So the link, as I say, is in the chat as well. So yeah, what has happened since the report was published on the 4th of April. That's been submitted to the Cabinet Secretary for Social Justice, as well as to the Social Justice and Social Security Committee. We've also shared it with Social Security Scotland as well as obviously publicising it. And I guess the recommendations are largely focused on Social Security Scotland. These are very much process issues, generally speaking, and we will continue to meet with Social Security Scotland to discuss this and further work. And just to pull out one of the questions that's come out, what progress we made in relation to its recommendations. So we don't really have a firm mandate to necessarily. We don't have to follow up on this report and mark Social Security Scotland against our recommendations, but we obviously do have an ongoing responsibility to see if the charter is being fulfilled. So we will continue to discuss this with Social Security Scotland and see what evidence there is of things changing. I don't know if anyone from Social Security Scotland's here, but there's a blog they've just published on the Scottish Government website looking at this issue of letters and different communication channels. Are there ways that things can be done differently to make the process more smooth for people who don't necessarily find a paper letter the most effective way to communicate? So I think these things will be taken into account, and yeah, we will monitor to how that goes. I don't know if Mark or Marilyn want to come in on that question of what we will do to monitor these recommendations. I'll leave them to think about that. Well, I just pick up another couple of questions that have come in quickly. One of them was, is there a definition of people with communication needs? And I think this is maybe something worth addressing. So we used the phrase communication needs because that's the way the Social Security Scotland client survey uses it, so that allowed us to compare like with like, and the client survey is asking people to self-identify if they had a communication need from a kind of definition of communication needs that includes needing time to understand, time to say what I want to say, to write things down, to see people's faces, to be able to speak to another person, to use Braille, to use assisted technology, to use British Sign Language. So it was a phrase that Social Security Scotland used as part of their client survey. Mark or Marilyn, do you want to come in on the question of monitoring progress? And another question that we have that's kind of similar is how do we intend to use our charter duties in the future? So a couple of questions there for you. I'll give you a moment to consider a response, and just remind people, if there's any other questions, feel free to pop them in the Slido. So I'll come to you first, Mark, and then Marilyn, to talk about how we're going to monitor our recommendations and what might be the future charter work.
Yeah, well, thank you for that tricky question. In a way, this is new territory for the Commission, because we've been used to scrutinising draft regulations since we were established in 2019, and there's a fairly established pattern there that our job effectively is to write our reports, submit our recommendations, and that the Scottish Government's required to respond and tell us which they're acting on and which they're not. And in a way, that's largely the end of that process. And I think we might be in slightly different territory with our work on the charter, that there probably is scope for a bit more of an ongoing conversation with both the Scottish Government and Social Security Scotland. What exactly that looks like, though, is something that we're probably still figuring out. I will say that, personally, I've been, very pleased with the engagement and the response we've had from Social Security Scotland up to now. As you saw in some of the figures we were quoting, all the various satisfaction ratings that we mentioned, they're a bit lower for clients with communication needs, but they're we're still talking in the 80s and 90s, and it would have been quite easy for Social Security Scotland to say that there's no big problem here, and that's not what they've done. They've engaged with the criticisms that have been made in the report, and that's been encouraging. Ed, what was the second part? Where we go from here?
Where we go next? Yes.
Yeah, I think
a nice easy one.
Yeah. I mean, there's two ways that we can go next. We can do another sort of own initiative report, as this one pretty much was, where we see something that appears to us to be a possible issue and act on it. There's also the Social Security Act stipulates that we are required to produce a report if we receive evidence of that certain charter commitments aren't being consistently fulfilled. So that could be one trigger. It hasn't really been the trigger in this case, but if that sort of evidence were to be brought to us, our hand would be pushed in a way, I suppose. That's a slightly evasive answer and long-winded way of saying we haven't decided yet, but having done our first charter report, we're certainly not planning to wait 7 years until the next one.
Marilyn, do you want to?
I think Mark said most of the things that I would say. I think the only couple of points I'd make is that, as you've said already, Ed, we came at this because of our reading of the client survey and the disparity in the figures, even though the gap is relatively small, there's still consistently less positive satisfaction ratings for people with communication needs, which we felt needed investigation. So in this piece of work, we've started to sort of scope out, with the help of people who participated in our research, what that might look like, what that happens to be in practice, rather than just as a survey response. I think in terms of how to monitor and where next, I think there are choices to be made, and we haven't yet got to the stage of working out completely what next. But I think if people do have ideas or evidence where there's some concern about the Charter, I think it would be great if we could hear from them, because we could then factor that into our discussions about what we could be doing next and what would be the best way to approach any future kind of research or development work on the Charter itself.
Thanks, Marilyn. I've got two screens here, so I'm not looking away. I'm just juggling the questions as well. There's a question here asking if it's possible to join the committee, as I feel I have a lot to add. So, as I mentioned at the beginning, there's 5 members of the committee at the moment, and that's set down in law, so there can only be 5. An argument could be made that it needs to be larger, but 5 is our limit at the moment. But 2 members will be standing down over the next 2 years, so there will be opportunities for people to join the committee, and that's done through a public appointment process through the Scottish Government's public appointments. But also we're looking at ways to widen out our engagement with people. So people who are interested can be added to our mailing list, which you probably will be for attending this event. You'll at least have our contact details, so let us know. We periodically ask stakeholders to respond to consultations on certain questions, so scrutiny of regulations, but also, as Marilyn suggested there, both individual pieces of charter work and what our charter work should look like. So we're very keen to hear from as wide a range of people as possible on those discussions. Unfortunately, no vacancies at the moment, but there's certainly opportunities to get involved. I've got a question here that I don't know if Mark or Marilyn want to pick up, but is there justification for looking at other communication needs, e.g. people whose first language is not English, in further research? Do either of you want to pick that up?
Should I just make a couple of points, and then if Mark might have more to add. Certainly there's an issue for people whose first language isn't English, and we did come across that, but the focus we wanted to have for this specific piece of research was around communication needs relating to a particular impairment. So there's certainly scope for more work to be done on people with other kinds of communication barriers, and it is something that we think could certainly benefit from further research, and could in fact help towards improving take-up as well. So I think there's definitely scope there, whether that's for us or for others to do, either Social Security Scotland, Scottish Government, or other research organisations or third sector, is probably for debate. But I think there's certainly scope to and justification to look at other kinds of communications barriers.
Yeah, and all I'll really add is that this was something that we did talk about in the early stages of this research, but we eventually decided to limit the scope to communication needs linked to an impairment, and part of the reason for that was simply to keep the study to a manageable size as much as anything. But yeah, it would certainly be legitimate to look at that.
And I think maybe just to add, in some of the work we've done on scrutiny of certain specific regulations, this has come up as an issue. So, for example, the work we've done on carer support payments and the changes to that. And as the system in Scotland changes and maybe becomes slightly different from the UK system, there's more complexity in the system, ensuring that everyone is aware of what their entitlements are, as Marilyn suggested, came up as being really important. And that could be an area where people who think English isn't their first language may not be able to get that information in a way that's available to them. So it's certainly something to look at here. But as Marilyn says, who does that is a matter of discussion. I guess our responsibility is to report on how well the expectations in the charter are being fulfilled, and the evidence that we use to gather to make those reports could be research we've done ourselves, or it could be other people's research, or a combination of both. But it's certainly something that's on our radar to potentially be considered. One question here, I don't know if Mark or Marilyn want to pick up, but are there any implications for Social Security Scotland if they don't respond positively to recommendations or don't do it in a timely manner? We have briefly touched on that, and the response so far has been good. But Mark, do you want to?
Well, there's no sanction that we can impose on anyone if they don't respond to us. I mean, all we can do is publish our findings, show our recommendations, and Social Security Scotland will make of them what they will. And as I've said so far, they've responded pretty positively. We appreciate as well that they're under lots of pressures from all sorts of different directions, so we'll probably be competing for attention with others, but we'll carry on the discussion and make sure it stays on the radar as much as we can do.
And I mean, I think it's worth mentioning, but one of the kind of key social security principles in Scotland, which is embedded in the Act, which is that there's opportunities for continuous improvement are sought. So Social Security Scotland has a legal obligation to continuously improve in such ways as the evidence suggests, and hopefully our evidence is part of that pattern. And as I say, so far the response of Social Security Scotland has been to listen to what we're saying and respond positively. So yeah, we don't have powers of sanction, but hopefully powers of persuasion. A couple of questions are flying in now. A question: have we engaged with the First Minister and the wider cabinet around the findings? And another question about the Social Justice and Social Security Committee is whether we've had a committee session with them on the report. So the report has gone to them. It's obviously up to the committee what topics they wish to explore. Also, a copy has gone to the Cabinet Secretary as well, and we don't have a direct response from that yet, but two things to note. One, the Cabinet Secretary is coming to our June board meeting, and the Charter report will be on the agenda there, so there'll be a chance to discuss it then. And we're giving evidence to the Social Justice and Social Security Committee also in June, so we don't have an agenda for that meeting yet, but it may well be discussed. But we'll certainly be using every opportunity we have to highlight the findings of these reports. And as I think both Mark and Marilyn mentioned, one of the things that's needed is further research into some of these areas. If you just bear with me a moment. Yeah, so there's a question here. This is something that we kind of touched on briefly, with people with learning disabilities. And so the question is there potential for independent advocates to communicate on behalf of people with learning disabilities who don't have unpaid carers supporting them? And there's another question about responses to the survey, making the point that those with learning difficulties especially are often unable to complete surveys. Marilyn or Mark, do you want to comment on this?
I suppose on the responses to the survey, I think that is a fair point to make, that very often all we can do is rely on who actually responds to surveys. So we don't know the experiences of people who don't. So that's maybe something that we also would need to be bearing in mind, and something for Social Security Scotland to also think about when it's developing its next round of surveys and research. And I think on the access to independent advocacy, Mark may want to add something here, but I think the idea of having the right for independent advocacy is something which was intended to make it easier for people with a range of disabilities, but learning disability in particular, to be able to pursue a claim appropriately and have somebody giving them support to to do that, so that people aren't sort of left behind because of the lack of support. But I don't know if Mark wants to say any more about advocacy.
Yeah, well, certainly the right to independent advocacy is written into the Social Security Act, so it's there in law. In the process for accessing that is for Social Security Scotland to describe rather than us. But just to go back to the research we did, we did find that some of our participants thought that awareness was of that service was not what it could be. So that is one of the bits of food for thought that we've highlighted.
Yeah, absolutely. It may be people that need it most who aren't aware of the advocacy service. There's a question here: will the upcoming Scottish parliamentary elections have any impact on your longer term work? I think my take on that would be no. Broadly, we have a statutory body. We're in the Social Security Act. It would require a change to primary legislation to change our remit or disband us, which is obviously possible. The Parliament could always decide to do that, but I don't think there's any immediate expectation that parliamentary elections will have an impact. I guess what does have an impact is the amount of legislation that comes through related to social security. And we're at a point at the moment where we've had the establishment of a brand new social security system in Scotland over the lifetime of SCoSS for the last 7 years, which has been a huge amount of work. And the big question is what comes next. After this safe and secure transition, the groundwork for a social security system is set up. What kind of changes will come and what will that mean for our workload, both in terms of scrutinising new regulations and what impact that might have on the Charter. I don't know if Mark or Marilyn want to add anything on the upcoming Scottish parliamentary elections. If not, I've got another question for you. I'll prompt you with the next question as well, just to give you a moment to think. Did anything shock you in your findings? Is another question for you both to ponder. Either if you want to come in on either of those points, either the Scottish elections or anything particularly that shocked you.
And I think you've probably covered the elections, the Social Security Act, including our role and the principles, got unanimous support from the Scottish Parliament at the time. So probably not anticipating fundamental change, but you never know. But that's not for us to decide. The findings, I mean, I don't think they particularly shocked me. They were all quite in line with with what actually prompted the research, was that people with communication needs were, less satisfied than the client base as a whole with the service we were getting, but still fairly satisfied with it. And I think that was reflected in the conversations we had by and large.
Marilyn, anything to add?
I don't think I have anything to add on the question about the elections. I think you've both covered that. In terms of being shocked by anything, I don't think I was shocked. I think I was a little disappointed to hear that people who had asked for support didn't always get the support in the way that they had wanted or in the format they required. So I think that's something which we've certainly reported on and made a recommendation on. So I would hope that that is something that we, with Social Security Scotland and the Scottish Government, can make some progress on as we go forward in the spirit of continuous improvement, as you mentioned a bit earlier on, Ed.
Yeah, and I think just on that, I guess there was in our discussions of Social Security, sometimes it felt that in the cases the guidance hadn't been followed properly, and we weren't able to identify individual cases, obviously, from our stakeholders, so Social Security couldn't follow it up. But it felt like a training issue, but also there might be some process issues where preferences of communication maybe aren't recorded at the earliest possible opportunity, and that could be a process that could be changed. So I think the discussions with Social Security Scotland have been quite useful in quite a detailed level to understand where the issues are. There's a question, has DWP shown any interest in this research? They have been sent copies. I don't think we've had any response yet, but I think it's fair to say the DWP are aware of what happens in Scotland and are interested, and if there's stuff that applies to Social Security Scotland, it may well apply to DWP. We also meet with our counterpart body, SAC, down in London, who do a similar role for Westminster, and if there are any sort of joint areas of work, we could work with them. Bear with me, there was a question about multiple formats if required, easy read and audio versions. So I wasn't sure if this was related to SCoSS's work or to communication with Social Security Scotland, but in terms of our work, we have made the report available as an easy read and as a BSL, and one of our kind of key strategic aims over the next session is to improve our accessibility of our reports. So that's certainly something we're aware of. In terms of Social Security Scotland, yes, you have that they have an obligation to communicate with you in a way that's useful for you, so that should be provided. We're getting very near to the end, so Mark and Marilyn, I'll just come to you to see if there's anything you want to add to say that's not already been said, or anything you want to add before we kind of sum up and finish. So Mark, I'll come to you first.
No, nothing terribly substantive to add, just that it's been a very it's been a long road getting this report out. It's very pleasing to see it there, and pleasing that so many people have made the effort to come and listen to us talking about it. So thank you all for that, and we'll pause for breath before we launch into this again. But now that our charter oversight role is officially off the ground, I'm hoping to see that continue too.
Marilyn, anything to add?
Well, just to say a huge thank you to all the organisations and individuals who participated in the research with us, and to people who've come along today and put forward questions. So I'd really welcome any kind of further feedback that people may have about the report and how we can move forward and what we could be doing next. So thank you, everyone.
Yeah, and we should also actually thank Andrew and Chris from our secretariat, yes, because they put a huge amount of work into this, and neither the report nor this webinar would exist without their efforts.
Yeah, absolutely.
Absolutely agree, and scrutiny work comes at us. We don't have much control over when legislation comes in, and the past few months have been incredibly busy in terms of both legislation and getting this report finished. So yeah, huge thanks to Andrew and Chris, also Lisa and Stephen. Thank you, Mark and Marilyn as well for this, and also the other members of the board. I know Adam is here. Adam and Judith Patterson don't think could make it, but their feedback into it. The report is available on our website, or if you need a copy and can't find it, then please do drop us an email. We will be sending you an email to get some feedback on today's event, and also any feedback on the report. As we've mentioned, this is the first piece of work we've done looking at the charter specifically, and this is our first webinar looking at this piece of work. So please do provide your feedback. What can we do better? What works best? And a huge thanks to Neve for providing the translation today, and yeah, a massive thanks to all of you for giving up an hour of your time to hear about this really important piece of work, which we hope will make a real practical difference to the way Social Security in Scotland is working, and make that improvement. So many thanks for your time, and please do get in touch if you've got any further questions or comments to make.